Are you pregnant and your back is starting to kill you already? Or maybe you're in postpartum and your back is still bothering you from pregnancy? Well, this video is for you. So one of the things I commonly see during pregnancy and even in postpartum is SI joint pain. So that's that pain that is right around this area, and it can refer into the glutes, into the hips, and into the thighs itself. You'll typically notice this pain with transitional movements. So going from sitting to standing, going from laying on your side to getting up from the ground, any of those big changes of positions, you'll find that you tend to have more discomfort with bending backwards. So going back this way. And with this, a lot of times I like to focus on doing a lot of stability type exercises. And again, it always will depend on your clinical presentation. So working on some things to help give better core and glute stability and get everything moving better. For SI joint pain, here are the most common exercises that I'll give some people to get started with. So first, a cat-cow, and with this, we're not just going up and down. I like to think about moving one segment at a time, starting with your head looking down, rounding that mid-back, rounding your low back, and then tucking your tailbone. And then you're going to start at the bottom, gently arching your low back, rounding through here, and then looking up. It's important to note that you only move as much as you can comfortably. You might feel a slight discomfort, but I don't want you pushing far, far into pain. The next exercise that I'll have someone do for their SI joint is just some deep breathing, getting the belly moving more, getting some good breath expansion into your low back, and getting the core engaged. So taking a nice, good inhale. When you inhale, you want to think about letting that breath expand into your sides and into your low back, almost into that painful area you want to breathe into. And then as you exhale, you tighten that lower tummy. So to find that area, put your fingers right on those front prominent hip bones, slide them in just a little bit. And then as you exhale, you just want to gently feel that puff up into your fingers. One of the next things I'll try for the SI joint is a muscle energy technique. So you're going to push one heel into the table and the other thigh into your hand. You're going to push with about 30% of your maximal effort. Hold that for about 5 seconds and then relax. You can keep your leg in this position between sets if it's more comfortable for you. So again, a nice 5-second push and relax, and then try about 10 of those. Now, if you're doing that and you find it's increasing your symptoms, try doing it in the other direction. If it feels better in one direction than the other, then stick with that. So here, pushing my right heel into the table, pushing my left thigh into my hand, 30% effort. And if you find, oh, this is actually making my pain better and it's decreasing, then keep doing this side. One of the next things I'll do, so you can use a towel roll, a foam roller, whatever you really have, and you're just squeezing those thighs into the ball, 5-second hold, and you can do about 10 of those.